Welcome to the Hope Podcast. My name is Jonathan James, and I'll be your host today. It is great to be a part of an amazing organization to start off a new year to help with patient advocacy, where we get a chance to talk deeply about patient issues that matter to you and to me. I am excited today to have a great conversation with two friends of mine who have been involved in patient advocacy for many, many years, Dane Christensen and Jim Romano from the Health and Medicine Council, who are going to give us a lot of insights about what just happened. I mean, last year was a wild ride when it came to policy work and the things that we've experienced as a community. And I am really looking forward to going to a deep dive to talk a little bit more about patient advocacy and what's important as we look forward into 2026. But for now, I want to say a big thank you to our episode sponsor, Genentech. Well, I'd like to start off with introducing our first guest, which is Dane Christensen from the Health and Medicine Council. Many of you know Dane from our advocacy events. Dane, thanks so much for joining us for the Hope Podcast today.
Absolutely. Thank you for having me.
Well, also, I'd like to introduce Jim Romano, the famous, the infamous James Romano. And it's great to see you too today, Jim. Thanks so much for joining us for the Hope Podcast.
Oh, anytime, Jonathan. Thank you for having me.
Well, I'm really excited to talk about. I love new beginnings. I'm excited about a new year. I think that there's so many, wonderful things about getting a fresh start, and this year is hopefully no exception. But man, we have been through so many new things in the past year. I haven't been doing advocacy as long as either one of you guys. You guys have been deeply involved for over 2 decades, but as long as I've been involved in doing patient advocacy in policy work, especially at the federal level in Washington D.C., one of the things that I've known over the last 10 or 15 years, I have never seen a government shutdown that lasted as long as it did. I've never seen, the continuing resolution process take as long as it has. I've never seen, the one big beautiful bill that I choke on every time I try to say that phrase. But some of the things that we've seen have been really, really new, and at the same time, there's a lot of continuity. There are some things that are the same. The procedures are the same. And I have a difficult time sometimes wrapping my head around all of those things, but you guys are really, really experts about that. And I want to dive into a lot of those issues. But really, I'd like to start maybe for people who are listening to this podcast today who don't know you as well as I do. I'd like to start off with some introductions and just get a second to be able to learn a little bit more about your experience. And Jim, I'll start with you. You've been in patient advocacy work for decades. I mean, you're ancient at this point. Just kidding. But you have been around for a long time. Tell us, how long have you been involved in patient advocacy and kind of your background in getting involved in this type of work?
31 years, if you can believe that. I can't believe that, but
Wow.
it's been 31 years. March of 1995, my uncle Ed Burke came to Washington to advocate for the Ricky Ray bill. I was a freshman in college, and he said, "Well, let's get together for dinner. I'm going to be in Washington." And then he said, "Well, why don't you come to Capitol Hill with me?" And I did. And we went to our first meeting with, I think it was in Congressman Tom Fogley at his office, who's not even there anymore, and from Philadelphia. And we worked and got him to co-sponsor the Ricky Ray bill. And I'm like, I want to do this for the rest of my life. And sure enough,
Wow.
31 years later, I'm still doing that.
That's
It's
amazing.
firm now. Yeah.
Yeah, that's amazing. The it's amazing sometimes the things that are the catalyst to helping us to get passionate about this. And I just appreciate the fact that you're personally connected to bleeding disorders, specifically hemophilia, obviously within your family, and love to have your experience as a leader in this space. Dane, I'll ask you the same thing. Tell us a little bit about how you got involved in patient advocacy and what gave you the desire to do what you're doing today.
Yeah, absolutely. And what I'll mention to start from the start is I grew up on the north side of Chicago. And people, when they think of biotech, they think of the Bay Area of California, they think of the Bay Area of Massachusetts. But Chicago, particularly the north side of Chicago, has an awful lot of biotech as well. And when I was the age when Jim was advocating for the Ricky Ray bill, we had just mapped the human genome. This was going to be a watershed moment in medicine. We're going to cure every single condition under the sun. And I'll just tell folks, I've been doing this work since 2004. So that tells you kind of the timeline it takes to get innovation and kind of scientific breakthrough at the research level into commercialized product that people actually use and doesn't just end up in a journal that sits on a shelf. Because, even just a couple of years ago, we started to see the first results of that breakthrough with the first gene editing technologies coming to market. So I was always very interested in that part of it. But my congressman was also a gentleman named John Porter, who was the head of the appropriations subcommittee in the House of Representatives that funds medical research and NIH and public health, the Department of Health and Human Services. And, he was a middle of the road, practical person. You kind of have to be as a committee chair. But I think folks might remember this was the contract with America years. Newt Gingrich is Speaker of the House, Bill Clinton is president. So if you think now is kind of a time of discord and division, Congress is always in a little bit of that state. But even with those types of differences, they still managed to double the budget and double the funding for the NIH. So that type of work goes on in Capitol Hill every day. Um, I found it very encouraging. And I'll just say, the progress is what kind of keeps you interested over all these years. But I don't want to filibuster this meeting. So I'll hand it back over to you, Jonathan. But thank you for giving me the chance to introduce myself.
Well, it's really thrilling. I actually it's interesting you bring that up. As much as we've worked together, I forgot that you started out in biotech, and it's amazing to see the progress and the change that happens. One of the things that I'm really passionate about, obviously, as a person living with a bleeding disorder and somebody who's been impacted by bad policies, I am ever amazed at how so many times, it's an education gap for these people who are in leadership roles that just don't know that we're going through difficult situations because policies didn't either A, didn't consider what our needs were as a community, or B, they were created by people who are intentionally trying to create barriers for access and need for these high cost medications and or treatment. And so anyway, I'm just ever amazed at how sometimes something so simple as the patient voice getting an opportunity to share our story can make such a big impact in helping these people who really genuinely most of these people who are elected officials want to help. And I think that that's something that's really powerful is that if we could share our story, it gives us an opportunity to be able to help elevate the needs so that they're educated enough to know that when these policies come to a decision point, they have the ability to maybe make some of those decisions. The challenge is that there's far more people sometimes that are trying to make profit, that don't, appeal to what our needs are and maybe can stand in the way of that, and so I really tremendously value the work that both of you have done throughout your whole career and through your tenure and appreciate the fact that you guys are still, at it today and depend on your knowledge and your, wisdom, in helping advocate for people like we do every day as well, so, thank you for what you do. I want to kind of zero in a little bit on modern history and talk a little bit about these current events that have happened over the last 6 months because there has really been a lot of change that has happened and for all the things that we have seen in the last 20 or 30 years, maybe there's a few things as I mentioned before that are different this go around. But I want to start with HR 1. I want to start with this one big giant bill and talk a little bit about how it impacted healthcare specifically. And so, Dane, while I got you on the hook, I'll punt it to you first. But I'd love to know just your thoughts about what was HR 1 and how did it impact healthcare specifically.
Yeah, and I think it's important to say impacting because this was a budget bill. Budget bills are written for 10 years, and they are phased in slowly over that time. So Congress often revisits the policies that are implemented either as they're implemented or ahead of their actual effective date, which is a reason why it's always important to make sure your senators and representatives know what you're concerned about or how you might be affected. It's not a done deal. You can always weigh in and make a difference, and they want to hear from you. They know you have a pure self interest, and if there's something that's going on, you can provide them with that information. They need to make good decisions. They can do the politics stuff in front of the cameras, but they want to make policy in a way that works for the folks that they represent. So what the one big beautiful bill act was a budget reconciliation bill. So we have a new Congress that took effect. We have narrow Republican control in the Senate, very narrow Republican control in the House, and a Republican president. And usually, if you're passing any bill in Congress, you have to have bipartisan support. The process is such that everyone has to agree, and that's how things get done. If you don't agree, then nothing happens, and that's why the same issues are fought about over and over. But progress is often made right in the middle of the road. So when you have one party control, though, you get a little bit more latitude. You can pass a bill, a budget reconciliation bill that has to, but the caveat is it has to do with policies related to taxing and spending money. This is like kind of the fixed costs of the federal government. Um, but it gives you a chance to pass these bills on a party line fashion. Only one party can needs to approve them. If everybody can agree in this case, then that can get enacted into law. So it's a vehicle that exists outside of the normal process of everybody deliberating and coming up with a middle of the road solution. So this is why it got so much attention, and it was a broad sweeping piece of legislation. It not only affected what things like Medicaid. It also affected supplemental nutrition assistance. It affected student loans, these parts that are kind of part and parcel to the federal government operating. And once again, a number of these changes were announced or implemented, but are phased in over a number of years. And it's not uncommon for Congress to go back and revisit them before the effective date. Of course, every Congress is going to legislate in the way that it wants to. And stuff that's passed in terms of a 10-year bill is usually only good for it has a couple year shelf life, and then of course new folks after the next election are doing their own thing and listening to input from their constituents. So what it did do though was we knew there were going to be changes to Medicaid. And you might recall that there was a lot of talk about reducing federal spending or things getting, we're going to spend less money. And the only way to spend less money is if benefits are less generous. So, and when it comes to changes in the Medicaid program, there were certain realignments that were proposed and going on, some that had to do with eligibility or needing to continue to show or demonstrate that you are eligible for Medicaid benefits. Whereas it might be that you were checking in once a year. Now you might have to check in a couple times a year. So that type of compliance. So folks are taken off the rolls earlier if they have, something that disqualifies them from the program. And when my lights decide I've talked too much, they turn off on me. Bro, this happens without fail. But then the other thing that occurred was there's things related to how generous benefits are, so calculation of the federal poverty line. That was another consideration as well. Some of those things took effect early on, others are gonna be phased in later, down the road. So, I'll just take a pause there in terms of kind of what happened was it's a budget reconciliation bill, has the ability to pass with one party preference, which makes it a little bit more politically divisive. But the caveat is it can only be things that have to do with taxing and spending money. And you have to make sure everybody in the caucus agrees. So everybody had to say, okay, we're all on board with this, which in some ways would shed some of the more extreme positions, even though it's not going through the normal legislative process.
And from a procedural standpoint, this is not uncommon to government, right? This is something that happens every 2 years, right?
Yes, if you have the ability to pass a reconciliation bill, you are going to try to pass one. And it's really a question of realigning with your priorities. And it would be a safe bet that in a couple years, if there's a change in Congress's composition, they are going to use their legislative authority to pass another budget reconciliation bill. This bill is not the law for a decade. It's the law for right now, and Congress can revisit the law whenever they like. So they will likely continue to tweak this law itself as they hear from people or as they try to deal with some of these things. This is a fast moving process and it's a 3,000-page bill. So they're likely to go back and tweak things if they need to. They can do another reconciliation package this year if they feel like it. But of course, we're going to have a new Congress, 120th Congress in 2027. They probably aren't going to say, well, geez, the last Congress did this 10-year bill, so I guess that's it. They're going to want to put their legislative stamp on things, and they're likely to do their own package if they can.
Yeah. Wow. So, I'll say that, uh, with all of these changes, there was a lot of activity that we started to engage patients on that were concerning to us, such as, the extended tax credits being cut and potential for Medicaid. Obviously, the uh, able to work policies and a lot of different things that really took a lot of activation from our community to communicate. We were concerned about the blood safety division being, shut down during this time frame as well because we just had no communication in some ways. So, Jim, tell me a little bit about from your perspective, while this was going on, what made this unique to our community that really was potentially harmful, and then kind of where's the status of some of those things we were concerned about in the fall.
So, at the beginning of this administration, the president nominated Robert Kennedy Jr. to be the Secretary of Health and Human Services. Um, Secretary Kennedy has an idea of what he thinks healthcare should be, and then couple that with the president also brought in uh, um, Elon Musk and created this Department of Governmental Efficiency (DOGE) to help reduce spending, and there was a tremendous amount of cutting. And with the CDC, which I would say this administration is not a big fan of the CDC because of the COVID epidemic and um, in public health in general, there was going to be a tremendous amount of cuts, and it did hit the Office of Rare Blood, which houses several programs for the hemophilia community, bleeding disorders community. And so a lot of I want to be very fair here. Um, they cut some of the staff, and that was a big deal. They were starting to eliminate staff. Um, but one after a certain amount of time, when they also brought the staff back. So why was that? Well, they had their ideas. They wanted to do a realignment in the health in the health agencies. They wanted to create a new what I would call new agency called the Make America Healthy Again agency, and they wanted to do away with the Health Services and Resources HRSA, Resources and Services Administration. Um, what I could never understand is why they didn't just rename HRSA MAHA, but nobody called me and asked me what I thought. Um, and so there was going to be trading different offices within these entities, and so as soon as Congress started asking questions, several of these I would say staffers were being brought back into these agencies. And then Congress made it very clear that they were not going to do any kind of realignment with the health agencies, nor were they not going to fund a lot of these agencies. I would say the bleeding disorders population has a very community has a very they're very known on Capitol Hill. And so yeah, from what I could tell is the advocacy worked, that members of Congress are very clear that they're going to fund these programs. In fact, because of Dane Christensen's efforts, we've gotten additional funding into rare blood for another rare blood disorder called immune thrombocytopenia (ITP). So the Congress is listening. um, so pulling your hair out, setting your hair on fire isn't going to be the way to deal with these type of things. Um, but I would say that the administration tried to make a lot of changes. Congress has stopped those changes, and it's because of advocates like the bleeding disorders community, like the ITP community, like the other rare blood communities that have really been championing um, with their advocacy has helped keep the status quo.
Yeah. So, one of the things that I noticed is that there was this sense of like kind of chaos and urgency and almost a little bit of just there was so much confusion, surrounding around the process and what was going on, and I think that in some ways there was just like fear and worry. We activated our voice. I think many people in rare disease and chronic illness broadly were activating their voice. I remember Jim, you and I stood out in front of one of the buildings one day for like an hour just to get into the Rayburn building or something like that. Never seen that kind of line before. I mean, there was every group from every place that was literally out there trying to advocate and have their voice heard. And like you said, I think the fear, the worry was that there was no listening. I think there was some listening, but I guess Jim, for you, do you think that it was as bad as our worst fears, or do you think there were some things that were finalized that weren't maybe as bad as we thought it was gonna be?
So I've always known it's never as great as anybody promises, and it's never as terrible as everybody dreads. Reality somewhere in the middle. Um, Medicaid, there are going to be some interesting maneuvers with Medicaid. Some people are going to lose their coverage if they don't produce the work effort that the CMS is asking for, and state Medicaid departments are. I can tell you this, and I'm proud to say this, that Dane and I brought you and a lot of the Hope people to Capitol Hill, and because we didn't demagogue the issues, we had a very fair hearing on what we had to say to congressional offices. Congressional offices weren't closed to us, whereas towards the end of this debate in June and July, or I would say May, June, a lot of offices like, I can't take another meeting to talk about Medicaid. I was in a meeting where with an advocate who did not know what they were talking about and angered the United States Senator's staff, much, much to my chagrin and much against my recommendations. So, because they didn't have all the facts about the changes to Medicaid. So I was gonna say that, that Hope Charities has done a very good job, and I hope it's because Dana and I have projected we are remaining calm, we're not getting into the, demagoguing of the issues, and we're going to get everybody fair hearing, and I think that's earned a lot of respect on Capitol Hill for this organization, for
Mhm.
the community.
Yeah, I appreciate that. I feel like that's core to what, our mission is to keep a level head, number 1, and core to our values, I would say, but, not to get caught up in the emotion of it. And what's hard for, me as a patient and so many of the people that we, are, trying to bring along this journey, in the patient population is that it is personal. There's just no way around it. It's personal. And there is a reaction of fear and worry and concern, and I just feel like that. I really appreciate the fact that you've been a level-headed, advocate and advisor in that way to help us to stay on track with that, and really to quell your own emotions. I mean, I've known you long enough that I had the opportunity to know that we both get on a call sometimes. We're like, oh my gosh, what in the world, and then, but at the same time, we are able to go and say, okay, now what's the strategy? I think being strategic in our process of how do we communicate what the most important need is, and how do we woo them along. It's the old adage that you can attract more bees with honey than you can vinegar, and there's an element to that we need the support of these offices and these healthcare, advisors in these offices to be able to make certain that our issues are elevated and that we're respectful. And that's not always easy when you feel like that you're at, your life is at risk because of the policies that are happening. One thing in particular, Jim, I know you're very close to this issue, is we were very concerned that the entire blood safety division was going to be canceled and totally done away with. I don't think that that is the whole story, and based upon even what we saw in HR1 specifically, it looks like it was level funded or maybe even increased, if I'm not mistaken. And it sounds like that there's still some questions to be made, but I don't think it's quite as bad as what we were fearful of initially. Is that right?
Well, okay, there's a couple of things on that one. The HRSA and CDC hemophilia programs and blood programs have been level funded. So the funding is there. So that's the good news. The bad news is the advisory committee for blood and tissue safety, which um, after the HIV infection in the community in the 1980s was kind of a sounding board where people can bring it, where there was consumer members, there was physicians, and they built consensus on different disorders that are in the blood supply at viruses that could potentially have been problems. And you haven't seen the widespread problems that you saw in the 1980s from that point on. I think is a victim of its own success. This administration has, I don't want to say they've disbanded the committee, but it has gone dormant and it's not meeting, it's not advising the administration on blood policy, which it had been doing before. That's troubling. However, the Blood Products Advisory Committee at the Food and Drug Administration, that's still, as of right now, meeting. I would suggest that some of the pillars that we built after, I would say, the Ricky Ray experience, have been removed, but some of the pillars are still there. I just it's shakier now. I know that we would like to work to see that the advisory committee starts meeting again, and it has patient voices and has expert voices on it. I think that Americans should demand that because we all have blood, and it all and one something that we're not foreseeing could become a problem. And this was a committee that could alert the federal government and the administration, whichever administration it is. I'm hoping that the next administration will revive, start utilizing, and take this, make sure it's not this advisory committee is not dormant anymore, and allow it to start meeting. So um, I'm I'm the money is there into the agencies, which is a good thing. Probably still have to restore some staff. The only troubling part of this is that a lot of Republicans and Democrats have asked questions of the Department of Health and Human Services, and they've all come back to me and said they're just not responding. They're not responding to Democrats. They're not responding to their own Republicans. That's the troubling aspect to me, is that the only way you're gonna get answers out of the Department of Health and Human Services is by having them in front of Congress and Congress asking the questions right to the secretary, and I think that's a bigger concern, at this point.
Mhm. And Dane, specifically on the continuing resolution side, I do think that it is a good thing that the funding is at least still there so that we know that there's a plan in place likely for this to come back, even if the structure is not clear at this point. Is that your assumption too?
Yeah, I would remind folks that, there's 3 separate co-equal branches of government. And we live in a country that has free speech, which means you can go in front of a podium and say almost anything you want. But the policy-making apparatus, the law is very different. Me saying something at a podium doesn't change the law or what the policy is. It's just me talking, and that's part of being an American. But the thing to remember about the process with those 3 separate co-equal branches of government is that nearly all of these decisions go through Congress. If you want to create a new agency, if you want to consolidate staff into this new entity, you can say you want to do that and you can start firing people, but ultimately it is your senators and representatives that decide what happens. And this time around, they said, we're keeping everything status quo. We would even keel, no major changes. And that means that the money is there for the programs that we traditionally support. And we expect that they will start rehiring staff. But of course, the squeaky wheel really does get the grease. So if people didn't, the administration is not set up to take your input and respond to you. That's not their function in the federal government. Neither is the courts, the other branch. The people who are supposed to do that are your senators and representatives, and they have the power of the purse, and they have oversight of federal agencies. And if they put into a bill the advisory committee on blood and tissue safety needs to start meeting again, and here's their directives, then there isn't much ambiguity about what's going to happen. But if you don't tell them there's an issue, similar to not clearly explaining the gaps you might be dealing with in your own coverage or access, they don't know how to help, and they're not just going to voluntarily try to figure it out on their own. They very much respond to constituents. It's a member driven process, but the members are driven by the people they represent. And if you're a rare disease community, it's very important that you be that voice, because there's a chance there aren't 100 other people in a similar situation where somebody's just saying, "Well, I'll be the one to have the meeting," or "I know the congressperson." If you're not doing it, who will? So we encourage, but the important thing is the members are listening to you just as much as they're listening to what the White House is saying on any of these policies.
Yeah. Yeah, that's a really good point. I do think that, some of these tensions were also part of what led to the government shutdown, if I'm not mistaken. I mean, there was, a lot of contention. We saw a lot of headlines. I do believe that, unfortunately, in our, you mentioned free speech and, the media and so much of our even social media, it just everything is, when I used to be in financial planning, we used to say that everything is driven off of fear and greed. I think sometimes in media, the only thing that gets attention is the extremes, right? It's really not what maybe the substance is in the middle, like you said, Jim. And I think that it's important that we kind of look back at this. So my question is like, Dane, what the heck was the government shutdown about this time, and why the heck did it last so dang long?
Well, I'll say I'm glad I do. Well, the short answer is politics. So, but I'm sure that's not necessarily what's going to help anybody out. But the reality is, we had a 43-day shutdown, the longest government shutdown in U.S. history. And policy isn't why the government got shut down, because the reality is, we had a bunch of bills that need to move forward, and Congress is fighting about these high profile issues, but the process is still moving a number of initiatives forward calmly, quietly. They don't get any attention, but it's still happy. There's hearings going on today and this week where they're moving bipartisan bills forward. So the idea that Congress isn't doing any legislating is not accurate, but they're fighting about things. And you're right, the fighting is getting all the attention. When they're doing the stuff where they work together and there's no real drama, that doesn't get any attention at all, but it matters. But what happened with the shutdown specifically is that it continued to delay work on a bunch of healthcare stuff that should already be done. We have prior auth reforms that are being considered that are very bipartisanly supported, but haven't gone through yet. We have a bill called the Safe Step Act, which had 250 co-sponsors in the House, way above, 50% support. That hasn't gotten done yet. And more critical and timely things like reauthorizing the pediatric priority review voucher program at FDA for rare disease innovation, and doing things like the Kids Access to Care Act, which everybody agrees is a good idea to let kids in Medicaid and CHIPS see providers across state lines without going through a bunch of hoops. But that stuff is all delayed. So the real harm of this is a delay. And the reason for that is they say, Congress works for crisis or Christmas. So a lot of this legislating is done at the very end of the year. And that's when the shutdown occurred. The shutdown occurred basically from October through November. And the reason you have a government shutdown is when both sides politically feel like the shutdown will benefit them. And what happened right before the shutdown ended was we had an election. And that was the key reason why we were in this stalemate. There were a bunch of state, local races that were being run, not the big Congress ones, and not the ones that occur every couple of years. But and there was this whole discussion about healthcare affordability. And there were a couple of things that happened as a result of that election. One was that you had a lot of people who leaned into this message about healthcare and access and affordability. Those folks won. And they were kind of a younger, generation, a new, new folks on the scene of politics. And the immediate first thing was the old guard said, "Well, I guess I'm a little bit out of touch at this point. I'm gonna retire." And we've seen, not to cast aspersions, but one of the first things that happened was Nancy Pelosi said she's not running again. Just today, there's a guy named Steny Hoyer who's been Democratic leader for decades that said, time to turn the page. So this is the kind of message that gets sent. But on a policy standpoint, the other thing that happened was Congress noticed this discussion about healthcare affordability, access, and coverage is really important to a lot of people. So then, almost immediately, with the government reopening, you had Democratic and Republican proposals on how to make healthcare more affordable. And of course, you can't have one party support. So there's going to be a forming, norming, and storming process where they have to negotiate a middle of the road solution. But now everybody is talking about this again. And there are vehicles moving forward legislatively that are going to be focused on healthcare. And they're going to be things that everybody agrees is a common sense good idea. But what the shutdown did and how it was resolved pushed healthcare and specifically patient out of pocket costs back to the forefront of policymaking. And that's why it's even more important that folks share their stories as policymakers decide how to solve some of these issues, because it's a safe bet that if you were just elected, and you've been in Congress a year, you might not know everything that you need to know about the rare disease experience to figure out how to handle policy making for someone's healthcare coverage access, either private pay or federal programs. But that's kind of the long and short of it. The short answer would be politics. The longer answer is there's implications in terms of specifically how they're now handling healthcare, and we just saw that with this advanced premium tax credit debate. So, that was an issue where Congress had said, these tax credits are expiring. They were designed to expire. It's over. And because people were so concerned about their premium costs, they are still today debating how they are going to solve this issue and potentially even reinstate these tax credits or do something different that will provide equal relief for what people are personally paying for their health plan premiums.
Yeah, one of the things that we were super concerned about was the cost of insurance premiums going up exponentially. And it's interesting because you mentioned these enhanced tax credits. I think that the people need to understand that this came about was because originally in 2009, when ACA was enacted, there were certain things that were enacted at that time. It made sense economically by what was happening in the economic landscape in 2009. Health insurance premiums have traditionally increased year over year between 7 to 8% every single year. There has been extremely big jumps at times. That's not new, and there's a lot of again theater that's sort of portrayed in these extremes that you see on media. But sometimes the premium increases continue to go up. The cost of medication has gone up, yes, and the cost of care has gone up, yes. But I think the issue here is that Congress enacted these enhanced tax credits at some point, kind of several years after ACA had been enacted, because they realized that 400% of federal poverty level was probably a little too low, and also that the premiums had gone up, and even with the tax credits of you know the premium assistance that was being provided through the marketplace was not enough to still keep it affordable. So they gave additional tax credits to be able to help people to afford it. Essentially what changed, if I'm understanding this correctly, is that in one big beautiful bill, they basically said we're going to let those enhanced tax credits expire, and that's where really the stalemate came in, to where they said, hey, we're going to hold you accountable to this, and again, the elections were sort of a pawn to sort of like, let's see if we can get some other people in these roles to help to move this needle forward. Essentially, that was said. What one party said was, hey, this process is debated on the floor every day. Let's put this back on the floor where it should be in subcommittees and committees. And by doing so, you're not basically being held hostage to this concept of the total budget and all of this stuff. So a lot of moving parts going on here, but essentially that debate has not stopped. Even though HR1 was enacted, the actual enhanced tax credits is still being debated even on the floor now. Am I correct in saying that, Dane?
Actually,
Yeah,
exactly.
right, literally today. But, Jonathan, I think what this speaks to is a broader, point about, Congress and also how folks can engage with it. So, if you're talking to your member of Congress, is not materially significant to say, "I am pro Medicare for all," or "I am pro, healthcare savings account," or some other position. that you might see debated ad nauseum on TV at night. What's important is that you tell them what your situation is. This is what happened to me, and be honest and factual. They need to work with their colleagues to solve those problems. The other stuff that's thrown on there is window dressing. What they need to do is work for you, and they can do that if they know your story. But this is all part and parcel to a broader debate about affordability. The concept of pharmaceutical benefit manager reform, which has been going on at the same time, is happening on Capitol Hill because Congress said we vertically integrate a bunch of these health activities, then we should generate savings. But there was vertical integration and costs went up. So they're saying, how did we this end up more expensive with economies of scale? Um, what matters when they try to solve that problem, though, is not that some middle manager can claim a bigger discount on a drug. The only thing that matters is that do your out of pocket costs go down at the end of the day. So that's why I
That's
think,
right.
yeah, this that the ecosystem is going to be what it is. Your voice on Capitol Hill matters when you are honest and accurate with your story and you say, and I need your help.
That's good. And Jim, you've been working at this at nauseum. I mean, there is so much happening here, but really and truly, again, the enhanced tax credits might be able to come back in play. I know that's being debated literally today, but like, what is your gut feel on that?
I think there's going to be some kind of compromise. So it's interesting. One of the patient assistance organizations did some analysis of their data on what the increases were going to be, and there was like a over across the board 22-25% increases in people's individual premiums because of the expiration of the tax credits. We were able to help them and put that in front of congressional hands. And I got to tell you, I heard back about 5 or 6 congressional offices saying thank you. And those were Republican offices saying thank you. The test vote yesterday. So this talk about an arcane process, and we used to bring up this process when we are talking about Ricky Ray, but it's the in the House, it's this discharge petition. So if you get 218 congressmen to sign a petition, this discharge petition, it 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 moves the bill to the floor in a certain number of days. And so because the majority that the Republicans have is a very small functioning majority, and it got to be even less this week with the resignation of Congresswoman Marjorie Taylor Greene and the death of Congressman Mahalfa out of California. It's a right now it's at two seats. You know there really isn't that much um, wiggle room. So, and a lot of these moderate Republicans, Mike Lawler in New York, there's three in Pennsylvania, there's a moderate seat in Nebraska. They know that if they don't do something, that they're really in danger of losing their seats in November. We're talking history. I will say this: politics is like is circular, or I like to say because a Democrat's in office, the Republicans are going to look to win the House and the Senate and do well in Congress. The Republicans are in office, the Democrats are looking to do that. Very few times in history has that not happened. Right after 9/11, that the Republicans had a great midterm election. Other than that, the midterm elections really do go against the party in power. So they're trying to mitigate that right now. And so, fa to me, it's fascinating. But the Democrats are really actually trying to A, help the American people, I think, blunt this. And two, the Republicans actually want to join them, at least a number of them do. So several of them signed this discharge petition. The Speaker of the House has been very clear he doesn't want to have a vote on these tax credits. He's been very clear about that for as long as he's been Speaker of the House. Love him, dislike him, that's his position. Um, Same, and so why I'm saying this is that was the last, like that's what they did. They Republicans signed the discharge petition yesterday when they had a vote. Like 9 Republicans that joined the Democrats. The vote yesterday was a test vote. The speaker was trying to overturn the discharge petition, and he lost by nine Republicans sided with all the Democrats. So now, and we're talking about like Maria Salazar. We're talking about some pretty conservative, leading to conservative Republicans joined it. Jen Kiggins, those guys that were there. So now you're going to have a vote in the House. It's a 3-year extension. There's no way that's going to pass in the Senate. However, Senator Bernie Moreno, who's a freshman senator from Ohio, not a swing state, but a Midwest state where this is going to affect patients, has come out now and said we're negotiating. So what I anticipate happening will be a 2-year probably extension, and then a 2-year extension with some caps. Whether they cap the FPL, probably. And so that's what I'm looking at right now, which I think will happen. The problem I think that it actually hurts a lot more than it's running into the fact that the CR is going to expire on the 30th. So they have to get all this done kind of quickly by the end of the month, both the tax credits and passing the budget for the end of the year. Now they can kick that down a couple of weeks with the budget, but everything's starting to come all at once. So and colleagues can do multiple things. But it's an interesting time. It's an interesting time to be at a new firm working with my great friend Dane and working together and talking about these issues every day now.
That's amazing, really. You know, one of the things I always love about you, Jim, is that you're always a student of the process, and that you just are fascinated with it every day, no matter how long you've been at this. And so that always encourages me. You know, on you know, just that sometimes it's fun just to be, you know, observant, no matter what your own, you know, personal political persuasions are. But at the same time, I think that the what it really takes to be successful as an advocate is that we have to be students of this stuff, because if we don't know what the conditions are of the weather, we're not going to know how to steer the ship. And so I just think that your knowledge base in that is so super important. But I love that you're a student. You're kind of an advocacy nerd, and I love that about you, because it really helps to bring clarity sometimes in these things, and also take some of the emotion out of it. Because I be honest with you, I watch TV and I want to throw something at it half the time. So I'm glad that you're, you know, you're sticking in there. But it's good to know that these enhanced tax credits are still in debate, and that they may be reinstituted to some degree. I know that I can say this from a financial assistance point of view. We did see quite a bit of an increase for a lot of folks, even this past open enrollment, of about 35% or so. There were some folks that had doubling and tripling of their you know, premiums on ACA plans specifically. And those were people that were on the outliers for sure, but they definitely are people that are in the risk zone. So hopefully, if these enhanced tax credits do improve, that could maybe realign some of that. But it brings up another issue that you and I don't want to get into too deeply today, because I know our time's coming to an end here. But I do know that this really brings up another issue, where patients being able to leverage financial assistance programs and get access to financial help from charitable organizations like ours, or like the Pan Foundation, or you know, some of these other groups out there, are so important for people to be able to access that. And there's been policies in place like the copay accumulator, for instance, or you know, these maximizer programs, AFPs, all these other types of things that prevent people from accessing their medication because they can't, because of lack of affordability, really get in the way of that. And I think that there's plenty of opportunity for that, where we need to be locked and loaded, ready to advocate and speak up and share our story about these types of issues as well, because it all kind of ties in together, don't you think, Jim?
Absolutely, absolutely. Um, I would say so. You and I had worked together on, and Dane, the three of us actually had worked together back in 2016, 2017, 2018, um, on the Access to Marketplace Insurance Act, because as these Obamacare marketplaces were coming into existence, CMS, for God only knows what reason to keep these insurance companies happy, um, decided to allow them to not accept third party assistance. So, with the one hand, they say, "Oh, you can't deny a person for having a pre existing condition, but you'll have to accept any assistance on their behalf, premium assistance," which just really um, was interesting. I do find that an interesting problem. So then, moving forward, COVID hit, and there wasn't really, the it. We've all learned. I think a lot of the patient assistance groups built workarounds, and so now but now I love the fact that as the tax credits were expiring, the the insurance companies started sending letters again saying basically, "Oh, by the way, you can't get help with your premium," knowing full well that these people who have gotten these plans and have gotten these enhanced tax credits and are who are losing them are now going to look for people to turn to. And they made damn sure that they told these people, well, you can't turn to a charity. So in conversations with you and with Dane, I went back to one of our sponsors and said, "Hey, you won't believe this." And they weren't shocked, obviously, but they said, "Well, find us some people who are also interested on bipartisanly, and we might have to start advocating for to change this policy again." It just I will say this, the Republicans are really starting to turn against the insurance companies. Um, if you would listen to John Thune, Donald Trump, and a lot of other Republicans, there is I would say, a skepticism about the insurance companies. And so I think we're actually probably in a better position right now to um to try to change those kind of anti patient policies because the insurance companies, health insurance providers are not being held in a high regard.
Mhm,
I just hope other
mhm.
parties don't decide to adopt them then, but we'll see what happens.
Yeah, there always seems to be more people in favor of big business than they are necessarily in favor of the little guy. And it's kind of a David and Goliath story sometimes. We have this little bitty pebble that we're trying to put in a slingshot and try to influence, to look out for ourselves and to survive. And unfortunately, I think, you both said it, but being able to share your story of what I love how you said, Dane, making certain that you are honest about what happened to you. That right there may seem like a small thing. I know for a long time, one reason as a young adult that I did not want to get involved in, policy issues had a lot to do with the fact that I just felt like I didn't have anything to bring to the conversation because I didn't understand politics. I didn't want to be in politics. And oddly enough, I keep getting dragged back into this thing. But sometimes my story had so much more value than what I even realized because of the harms that I had experienced firsthand. And I do believe that it's super important for us to encourage our community that if you've had something harmful happen to you where you were really put at risk, your life was put at risk, or your health was put at risk, or your child's health was put at risk because of a horrible policy at an insurance company or at your employer or at some other thing. It is incumbent upon us that we have to raise our hand and share our story and communicate these things because Congress is actually trying to make decisions for the betterment of people that they represent every day. But if they don't have this information to go on, they don't really have the ability to substantiate even some of the changes that they want to substantiate. And it's a complex system. There's many, many moving parts, but never underestimate the power of your story. And I appreciate the way that you guys have framed that. I want to just before we go today, I want to kind of just highlight. I mean, there's we kind of talked about a broad swath of things that have just occurred, things that have happened in the past. But Dane, I'll ask this to you. But what do you feel like are some of the hot things that we need to be at least for as a community to advocate for as we move of 2026?
Yeah, I want to remind folks that your voice matters and that we see incremental progress every day. It's not that in that time, since 2004 that I've been doing this, nothing has happened. A lot has happened. Many diseases now either have become gone from life threatening to manageable chronic illness, or have had expectancy and quality of life extended dramatically, and that's because of innovation in healthcare, both on the treatment side and on the patient care side. Policy tends to lag behind, though. the rules and laws and the governing coverage and access don't move as quickly as innovation moves. So I think your voice is going to continue to matter, and in that sense, remember, up until 2016, or years ago now, 2009. Um, we didn't have protection for pre-existing conditions. We didn't have dependents can stay on family coverage till 26. We didn't have no lifetime and annual caps on benefits. So there's rarely a complete and total victory. It's usually incremental progress. Those issues have been addressed and now it's on to the next ones. And then if we do address things like AFP, copay accumulators, maximizer programs, there'll be something else that's stopping folks with rare chronic or life-threatening conditions from getting exactly what they need. But the constant in all of that is if you tell your policymakers what you're dealing with, and if you say, I think this is unfair, or I think any reasonable person would say this is unrealistic in what you're asking me to do, they will try to make sure the system works for you. That's how it's designed. So we're still making progress. We're still seeing those efforts, but those efforts are driven forward by people who have the courage to stand up, speak out, and make their voice heard.
That's so good. That's so good, and I'll take this as a moment to give a shameless plug because in June, 10th and 11th, we will be going to DC, and bringing some of our closest, uh, patient advocates with us, to advocate specifically on these issues. Another major moniker for us has been, patient choice. We believe that it should be if you are insured, that you should have the right to choose what medication, what doctor, and what specialty pharmacy that you use to be able to get the life-saving medications that you have. And we're really hopeful. We continue to see incremental progress on this bill that we've been working on now for a couple of years, related to any willing provider for specialty pharmacy choice specifically. But this is something that I think is really critical. We're going to be advocating more on that. If you've ever had a situation where it really pertained to where you felt like there was harm done to you because of not being able to get your medications in the way that you needed it when you needed it, we would love to hear your story. And so you can email us at info@hope-charities.org or go to our website to learn more about how to get involved with that. But again, this Hope on the Hill date specifically will be June 10th and 11th. That's not the only issue we'll be talking about. We'll also be talking about AFPs, alternative funding programs, where your employer plan prohibits you from getting your medication through your normal insurance channels. And we'll also be talking about the copay accumulator bill. The Help Copays Act was just reintroduced to Congress again, and we continue to need to put pressure on that. One thing that I've learned through the last decade or so of doing these things is that there really is, like you said, Dane, incremental progress happening every day. And I think about PBM reform as an example. That was something that's been investigated over and over and over and over again by all these subcommittees. I'm actually encouraged as we talk to offices. It looks like this thing is going to come to a head. I believe that there's going to be a large healthcare adoption of policies that will be adopted later on this year. And so it's really, really important. It's a critical year in 2026 for us to get our message out, get our voices heard. And we don't have to wait till June 10th and 11th to do that. We can call our congressmen and senators now to do those things. We'd love to help to facilitate that for folks who are listening. But if there's a way that we can work together, I think it's important that we get organized around these issues. We communicate effectively without drama, and we just try to make certain that we communicate with clarity and honesty, like you said, Dane, and keep our message in front of them because it is important to help them to be able to make the progress that's needed to be made on all of our behalves. With that, I just will open the floor to see, is there anything else, Jen, that you'd like to add or encourage people with before we go today?
I just, I would encourage people to try to get involved with the Hope on the Hill for June. It's very important. We need their voices, and one person can make a big difference. And so don't think that can't happen.
Yeah, so true. Dame, any?
I'll just echo Jim's comment, but absolutely.
Yeah. Well, thank you guys both for joining me for the Hope Podcast today. I really appreciate this conversation. We're going to be doing so much more together. It's like the Three Musketeers right here all day, every day. So appreciate all the hard work that both of you guys do. And we'll see you both soon. Take care.
Thank you.
Well, amazing work, and I really appreciate all of their help, but I mostly appreciate your opportunity for you to listen to this conversation because I really believe moments like this help us to form clarity as we start to collaborate with creativity. There's an opportunity for us to work together, and I really hope that you can get involved. And if you don't know how to do that, you can go to our website at hope-charities.org. You can learn more there about these opportunities. As I mentioned, Hope on the Hill, you can learn what we did last year, and there's also a new opportunity for you to get involved for that next year. We're also going to be doing more podcast episodes like this on advocacy and more issues that are important to people like you and me in our community. And I certainly hope that you take advantage of liking and subscribing. It really helps us out, helps get the message out further to your friends and family, and it really makes a big difference in the community. These podcast moments, oddly enough, we've seen an increase in listenership in the Washington, D.C. area. So just by you listening to this, it helps to improve the algorithm so that make sure we get this in front of the people who do need to hear it, even in DC. So thank you so much for being able to join us for this moment. And once again, I want to say thank you to our sponsor today for this episode, Genentech, for making this episode great. And we really look forward to seeing you in the next time. But for now, thanks so much. And we look forward to seeing you later. Take care.